Hello buddy, Senior Engineer, MBA and investor, and today's video I want to talk about Bloomberg's interview with none than the other Ali from ARK Invest. I want to talk about all of that in this video. Now before we jump into this video, you guys know the drill, you guys know what to do. Subscribe, like this video, YouTube algorithms and everything around it. You guys know how the algorithms work. So today's video, I wanted to talk about ARK Invest analyst Ali Yerman coming on Bloomberg's with Emily Chang, legendary Emily Chang from Bloomberg Technology Media. And I want to talk about this interview because it is actually, I believe, the first time that Ali comes on Bloomberg, one. And two, I believe it's been a while since we've had a genomics analyst on Bloomberg's technology. And Bloomberg, I always say, legacy media, I always try to stay away from that, especially CNBC, New York Times, Wall Street Journal, and all those legacy media, because all they want is like clickbait articles, clickbait headlines. But I think Bloomberg Technology, they do a good job covering some of these technology companies. I mean, they are called Bloomberg Technology, so makes total sense to me. So let's take a look at the interview.
Spike in Hong Kong and China as the World Health Organization has been considering declaring an end to the pandemic. Does this signal to you that it could get worse or maybe a lot worse before it gets better?
Thanks, Emily, for having me. It's nice to see you again. I think obviously we've had these spikes before. We've seen, multiple mutations arising from COVID-19, and this continues to be an ongoing issue that we're monitoring here at ARK. One of the things that we're thinking about is disruptive technologies that are in our portfolios that could potentially help the crisis. So, one such technology is CRISPR, which is essentially working to look at different cases and potentially being a diagnostic tool, but it's also used as a therapeutic tool as well.
Now, China has had a zero COVID policy, shutting down versus vaccinating on a broad scale. They've been using the Sinovac vaccine when they do vaccinate, but that's a vaccine that doesn't use mRNA technology and appears to be not as effective. Are we seeing that vaccine and that technology breaking down?
It's possible. At ARK, we've been very focused on the mRNA technology. And so we know that we've seen pretty great results from it from the US and also from Israel, where we've gotten a substantial amount of data. And so, this mRNA technology is a novel technology. It hasn't been used prior to the COVID-19 pandemic. We're following very closely what the companies are doing and how they're utilizing that technology, including, Moderna, but also Arcturus Therapeutics and several other companies that really are focusing. Of course, we can talk about Pfizer and the partnerships that they've started there, but also just the amount of sheer data that we're going to get from mRNA and be able to compare that to the adenovirus vaccines as well.
How has the pace of innovation in mRNA and biotechnology accelerated during the pandemic, given the role we've seen it play in vaccinations, along with CRISPR, as you mentioned?
Yeah, so the pace of innovations, Emily, is really interesting because we're seeing that, I think CRISPR is an excellent example, as you mentioned, right? So we're seeing these amazing examples. So prior to CRISPR, zinc finger nucleases, another gene editing form, also TALENs were in existence. And essentially those took a really long time to move from discovery to the first human dose. So that happened for zinc fingers in roughly 8 years, whereas CRISPR took less than half that time. They were at 3 years. They also can target many more unknown diseases. And so what we're seeing is there's a proliferation in terms of the pace of innovation. An example for that could be CRISPR Therapeutics. They're working on creating potentially functional cures for diseases like sickle cell and beta thalassemia. They've treated about 70 patients along with their partner Vertex, both companies within our genomic strategy. And we're seeing the data looks like it could potentially really be a functional cure. And so the pace of innovation, but also what's happening within innovation is really exciting right now.
Meantime,
So I really like how Emily Chang asked about mRNA, but then, talks about biotech, but then also talks about CRISPR, which to me, like, there are so many different companies tackling each of those verticals that we just talked about, biotech as a whole, and then there's mRNA, and then there's CRISPR, right? And I just found it unfair that Emily asked in one sentence all three, verticals that we just talked about. Clearly here, she's just trying to condense everything in a few minutes, as this video is. It's less than 6 minutes interview, so makes sense that they want to condense it. But I really like Ali's answer, about how CRISPR Therapeutics dosed over 70 patients along with Vertex, how the CRISPR innovation side of things is growing, and how it took less than 3 years, to go to clinical trial as opposed to 8 years with zinc fingers. So I really, really like that answer. Let's keep playing. Let's see what else we can find.
Controversy evolving in the gene editing world, which I know that you are following closely, where Nobel Prize winner Jennifer Doudna, who's made important discoveries in mRNA technology and been recognized for her work on CRISPR, has lost a patent dispute surrounding the discovery of her and her team around a specific part of CRISPR technology. What does this mean, and how significant is this?
That's right, Emily. First of all, I think it's great we're talking about this because it demonstrates a commitment from the scientists across the board. It's also quite a complicated topic. So I think it's great to delve in a little bit here. So first of all, what is CRISPR? Maybe we can back up a little bit on that. So CRISPR is a precise tool that is used for gene editing. We believe in it. We've been investing in it for years. We think it's an incredibly innovative tool. And it's revolutionizing the way we think about treatments, but also potential cures. Just a little bit of background here. It's essentially from a family of DNA sequences. And it was found to affect the genomes of bacteria, and it's now potentially using and in trials to be used for correcting genes in humans. So about the patent dispute, as you mentioned. So really quick background here, you covered some of this, really helpful. In 2012, Jennifer Doudna and Emmanuel Charpentier, they wrote a paper and it detailed the CRISPR system, but they didn't show that it worked in eukaryotic cells. And essentially, Emily, a eukaryotic cell is a cell that has a nuclease. So that could be a plant, and it's also certainly a human. Feng Zhang at Harvard Broad was the first one to do this. So there's essentially two sides, Jennifer Doudna and Emmanuel Charpentier on one side, that houses that IP from CBC, which is the University of Vienna, also UC Berkeley for both of them. Other side, Feng Zhang, Harvard, and the Broad. So in 2020, as you mentioned, Emmanuel Charpentier and Jennifer Doudna actually won the Nobel Prize in Chemistry for their discovery of CRISPR-Cas9. But as you mentioned, this past week, we saw that the USPTO, or US Patent and Trademark Office, did not follow suit. So what does this mean? Getting to the point here, this doesn't stop any ongoing trials. So all clinical trials will continue. It doesn't affect IP outside of the US. The most likely outcome that ARC sees is through some form of cross-licensing among the companies. And in terms of sort of the specifics for companies, so Editas, Verve, and Beam get their IP through Editas or the Broad, Harvard, and then CRISPR and Intellia through CBC, so through Emmanuel Charpentier and Jennifer Doudna.
Yeah, so basically it doesn't affect clinical trials. There's most likely going to be cross-licensing involved, and also the patent situation most likely will go on for another few years if no cross-licensing is done, because there are going to be appeals and so on. So generally a good interview. I think I love the answer that Ali Yerman gave. Shout out to Ali again. She works at New York now with ARK Invest, obviously in their offices, but she is from Montreal. So shout out to a fellow Montrealer. But I do want to talk about the importance of talking about CRISPR, genome editing, specifically with CRISPR when it comes to legacy media. I mean, you have an opportunity here as Bloomberg Technology to talk about one of the leading individuals when it comes to researching CRISPR genomics, and that is Ali Yerman from ARK Invest. But you start talking about mRNA, you start talking about biotech as a whole. And again, I understand, Emily Chang is not necessarily the most knowledgeable when it comes to CRISPR. It makes sense, right? She's covering like DoorDash, Uber, she's covering Facebook or Meta, Netflix, and all those technologies. And then she has to talk about biotech. That's why she bundles biotech, CRISPR, and mRNA all together in one question. And again, this is why I've started this channel, right? I think I've mentioned this months ago, and I keep repeating it. When I was researching CRISPR on YouTube, I saw, CRISPR Tommy doing his work. I saw maybe one or two other people doing their weekly, monthly videos, but I just didn't feel like they were specifically studying these companies, looking at the press releases, looking at phase 1, phase 2 data. But again, CRISPR Tommy definitely did all of that, but not the other individuals that I was following on YouTube. And that's why I started my own channel. This is why we have this community that's growing, which I want to thank you, everybody that's watching this video, because you guys are part of this change, this community that we're trying to achieve in the upcoming months and years. And the point here is that this is a testament, of what legacy media fails to do, right? They fail to cover these technologies, and it's always been like that, right? Until we don't have an FDA-approved drug, CRISPR drug/therapy, you're always going to see that, right? They're going to bundle with mRNA, they're going to bundle with biotech as a whole. CRISPR will be like, oh, it's genomics, right? Genomics will be, oh, it's biotech, right? Biotech is, oh, it's healthcare, you know? They won't be specifically studying each of these verticals, right? And it makes sense because you're condensed with time, you have other technologies, verticals to study, so you want to bundle everything. But you don't bundle Meta with Netflix, for example, right? You don't bundle Apple's iPhones with Tesla, right? You talk about each of these companies separately because of mainstream, right? So it is what it is. Let me know in the comments below what you guys think. If I'm wrong, let me know. Thank you so much for watching. If you like this video, found value, subscribe. If you've not subscribed, let me know in the comments below what you guys think. Again, shout out to Ali Yerman and ARK Invest. Thank you so much for watching, and I'll see you guys in tomorrow's special video. Thank you.